Hey everyone, today we are going to be doing our Health Science Careers Career Exploration Lesson 2. And today we're going to be talking about healthcare facility careers, medical services, and mental health and social service careers. So let's start with healthcare facility services. This covers different jobs all the way from healthcare administrators to environmental service workers. So healthcare administrators are the actual people who oversee the general operation of a healthcare facility and ensure that the patients are receiving adequate care. Health service administrators may work in hospitals, nursing homes, home health agencies, or medical units within prisons. Pretty much anywhere that any kind of medical service is being given, there's most likely a healthcare administrator overseeing the entire operation. They may also work at some specialty clinics and public health agencies. Now, typically, the only places that do not have healthcare administrators would be like private offices. So, like a private physician's office or a private dental office would not have a healthcare administrator because the doctor or physician would be the person in charge of that company. Otherwise, if it's like an in-network facility, such as a Novant or a Wake Forest Baptist facility or a nursing home, they're going to have a healthcare administrator. They must have at least a master's degree, but often they do have a doctorate degree. And the annual North Carolina annual wage is $88,000 per year, and the career outlook is about 16%. The central sterile supply technicians are also sometimes referred to as central processing professionals. They are the people who are in charge of sterilizing and maintaining the cleanliness of medical equipment and surgical tools and all kinds of different objects that are used within a healthcare facility. So they sterilize all instruments that are used for emergency rooms, operating rooms, and labor and delivery areas. They must have at least a high school diploma, and they typically have to go through an on-the-job training program because there is a lot of things you have to know in order to do that job to make sure that you are keeping everything safe and clean and preventing the spread of infectious diseases. The annual wage is about $30,000 per year, and the career outlook is about 14%. Environmental service worker is often referred to as an EVS worker. This is basically your custodian or janitor for a healthcare facility. But the reason they're called EVS workers is because they do have a few more responsibilities. Not only do they take out the trash and things like that, but they're also responsible for making sure that they maintain the cleanliness in patient rooms, that in between patients, rooms are cleaned head to toe properly. There's certain orders that you have to clean things in. You have to understand how to use various chemicals and cleaning supplies and interactions. They take out all the soiled linens. They do the laundry, the vacuuming, and they keep common areas clean as well. So they have a very, very important job in preventing the spread of infectious disease within hospitals. They have to have at least a high school diploma, and again, really specific on the job training to make sure they're doing everything correctly. The annual wage is about $28,000 per year, and the career outlook is 9%, which is kind of low. And I think it's because people do not see this job as something that's important or as something that they are interested in doing, but it's actually a really, really important job, and we always need more EVS workers. So let's look at medical service careers. Medical service careers include things like physicians, as well as physician specialties, physician assistants, and medical assistants. So a physician is anyone who can diagnose and treat injuries or illnesses, and physicians examine patients, they take medical histories, they prescribe medications, they can order, perform, and interpret various diagnostic tests, and they often help counsel patients on their diet, hygiene, and preventative health care, including lifestyle changes. To become a physician, you do have to have a doctorate degree, plus 3 to 8 years of a residency program, depending on what type of doctor you're becoming. The annual wage is $205,000, and the career outlook is 11%. And you're probably wondering, wow, why is the career outlook for a physician sort of low considering how much money they make? And the reason for that is because it's a lot of schooling. To become a physician, you have to go get a bachelor's degree, so that's 4 years, plus a doctorate degree, so that's another 4 years, so that's 8, plus another 3 to 8 years of a residency program. So you're looking at anywhere between 12 and 16 years of schooling to become a physician. So it's really competitive, but it's also, we are running out of physicians. More people are interested in those lower level healthcare jobs than they are in becoming doctors. There are actually 4 different types of degrees when it comes to becoming a physician. An MD is just a regular clinical medical doctor, and these physicians usually work in family and general practitioners' offices. A doctor of osteopathy, or a DO, is someone who believes in treating the mind, body, and the spirit, and they believe in some form of alternative medicine. So, whereas a medical doctor looks at the scientific reasoning behind injury and illness, a DO would look at more alternative changes like herbal remedies, therapy, lifestyle changes, diet, and nutrition. A doctor of podiatry, or a DPM, specializes in the foot and ankle area. And then a doctor of chiropractics, or a DC, specializes in the realignment of the spine. So this would be a chiropractor. When you become a physician, you also have the opportunity to specialize in many, many types of fields. And I have a whole list here of different examples of specialties, but this is not even all of them. There are so many different types of doctors out there and specialties. And the reason that you might choose a specialty is because you are interested in working with one particular type of patient. So, for an example, like a pediatrician works with children, a dermatologist is someone that treats the disorders of the skin, a cardiologist works with heart patients, oncologist is a cancer doctor. There are many, many types of different specialties. So there's 18 listed here, but like I said, there are many more. A physician assistant provides healthcare services that are typically performed by physicians, so they can perform a lot of the same medical services as a physician, but they are under the direct supervision of a physician. They are the ones that typically conduct all the physicals and provide treatment and counsel patients when a doctor is not available or when a doctor is working with another patient. In some cases, they are able to prescribe medications. They may only be able to prescribe certain medications, and they have to graduate from an accredited educational program specifically for physician assistants. The program is a master's program, and the average North Carolina annual wage is $100,000 a year. And the career outlook for a PA is 30%, and that is a very high number. The reason physician assistants have such a high career outlook is a couple of different reasons. Number one, they don't have to go to school for as long. So instead of like 12 to 16 years of school, you're looking at like 6 to 8. Number two, they still make a really decent wage, which is $100,000 a year. And with that, when we're talking about money, some facilities are more likely to hire a PA because they don't have to pay them as much as a physician. So they would be spending $100,000 a year on a PA versus $200,000 a year on a physician. So they may have 1 or 2 main physicians and then have like 10 different PAs that work under them that can all do kind of the same thing. So those are some reasons that a physician assistant has become much more popular, not only as a career choice, but it's just become more popular in the healthcare field. And then lastly, a medical assistant is someone that performs administrative and a few clinical duties, again, under the direct supervision of a physician or a PA. And they perform a lot of administrative duties, such as scheduling appointments, maintaining medical records, billing and coding information for insurance purposes. And then some of their clinical duties can include things like taking vital signs, medical histories, preparing patients for different exams, drawing blood, and administering medications as directed by a physician. So a medical assistant is kind of one of those multi-competent workers that we talked about earlier last week. So a multi-competent worker is someone that can perform some basic clinical skills, but does a lot of administrative work as well. And so it's helpful to have them around versus a unit secretary does only the administrative part. They don't have any really patient contact or patient care. A medical assistant can do both. The degree required is only a high school diploma, and then typically there's 1 to 2 years of on-the-job training. You make about $31,000 a year, and the career outlook is 22%. That's a pretty decent number, and the reason for that is because it allows you to get your foot in the door, working in healthcare, doing administrative stuff as well as working with a patient, and then allows you to be able to go back to school to pursue further career opportunities. Lastly, we're going to talk about mental health and social services. So we're going to be talking about a psychiatrist versus a psychologist first. So a psychiatrist is someone that diagnoses and treats and helps prevent disorders of the mind versus a psychologist, which is someone who diagnoses and evaluates for mental and emotional disorders through observations, interviews, and psychological tests. And they typically are the ones that can formulate and administer different programs of treatment. A psychiatrist is a doctorate degree plus 3 to 8 years of a residency, because a psychiatrist is looked at more as a medical doctor. They make an annual wage of about $208,000 a year, and they have a 20% career outlook. A psychologist is a doctorate degree plus just a 1-year internship, so it's a little less schooling. It's a lot less pay. It's $73,000, and the career outlook is about 25% growth per year. So when we're looking at a psychiatrist versus a psychologist, an example would be if I was suspected of having bipolar disorder or schizophrenia or something like that, I would go see a psychiatrist, and they would do different brain scans and diagnostic testing and treat me as a medical patient. Versus if you go to see a psychologist, you're most likely there to talk about anxiety or stress or depression, and your emotional state. And then they might just prescribe you like a medication, and then you would move on from there. Lastly, a social worker is someone who provides various social services and assistance to help improve the social and psychological functioning of children and their families, and to maximize the family well-being and the academic functioning of children. So we have a school social worker here that she travels to all kinds of different homes and situations across all 4 of our schools in Thomasville City Schools, and they do whatever they can to provide services that are going to help benefit that family. So whether that family has trouble accessing food, they're going to find a way to get food to that family. If they're having emotional problems at home or behavioral issues at home that need to be addressed, then they provide different services to handle those situations as well. They may also assist parents and arrange adoptions and finding foster homes for abandoned or abused children. In schools, they also help address problems related to teen pregnancy, misbehavior, and truancy, which is constant absence from school. Truancy is if you're absent from school a lot. You can be taken to truancy court, and so they handle those situations as well, and they also help to advise teachers. Social workers technically can get a bachelor's degree, but I have mentioned before that social work does typically require, in most cases, a master's degree. That is becoming kind of the norm. So you can get a bachelor's degree in social work, but if you're really interested in pursuing a lifelong career in social work, I would recommend going for a master's. The average North Carolina annual wage is $46,000. That's a little low in North Carolina. That is higher in other states, and the career outlook is 10%. That is everything from lesson 2, so you can always pause this, go back and take notes. You also have a lesson 2 career matching game that you can play to help practice these different careers, and then you can continue working on your healthcare career display projects, as well as working on your Watch and Talk series part 2. If you have any questions, feel free to text me or reach out or email me, and I would be happy to help. Bye, guys.